Hi everyone, my name is Navinthiran Thandapani. Today I am going to present about Addison's disease. Before that, welcome to my channel. To those who haven't subscribed to my channel, please subscribe the channel. And if you like the presentation, please give a like and share your comments down there. Okay, what is Addison's disease? Addison's disease, also known as primary adrenal insufficiency and also hypocortisolism, is a long-term endocrine disorder in which the adrenal glands do not produce enough steroid hormones. Symptoms generally come on slowly and may include abdominal pain, weakness, and also weight loss. Addison's disease is a rare but serious adrenal gland disorder in which the body can't produce enough of two critical hormones, which is cortisol and aldosterone. Patients with Addison's disease will need more hormone replacement therapy in their life. Cortisol actually helps the body respond to stress, including the stress of illness, injury, or surgery. It also helps maintain blood pressure, heart functions, the immune system, and blood glucose, which is the sugar levels. Aldosterone affects the balance of sodium and potassium in the blood. This in turn controls the amount of fluid the kidneys remove as urine, which affects blood volume and blood pressure. Okay, this is how an Addison's disease person looks like. Okay, there are some causes of Addison's disease, which is Addison's disease is caused by an autoimmune response, which occurs when the body's immune system, which protects it from the infection, assaults its own organs and tissues. With Addison's disease, the immune system attacks the outer portion of the adrenal glands, the cortex, where the cortisol and aldosterone are made. This is the main cause of the Addison's disease. Some other causes of Addison's disease are the injury to the adrenal glands, infections including tuberculosis, HIV, AIDS-related infections, and fungal infections, cancer cells from another part of the body that have invaded the adrenal glands, and bleeding into the adrenal glands. Next is surgical removal of adrenal glands. Mostly here is something related to the adrenal glands, which can cause Addison disease. And also amyloidosis, which is abnormal buildup of certain proteins in the organs. And the last one is genetic defects, can cause Addison's disease also. Okay, these are some symptoms of Addison's disease. The damage to the adrenal gland happens slowly over time, and symptoms occur gradually. The most common symptoms include abdominal pain, abnormal menstrual periods, craving for salty food, dehydration, depression, diarrhea, and also irritability. In some cases, such as an injury, illness, or time of intense stress, symptoms can come on quickly and cause a serious event called an Addisonian crisis or acute adrenal insufficiency. An Addisonian crisis is a medical emergency. If it is not treated, it can lead to shock or death. So it's so serious. Symptoms of an Addisonian crisis include feeling restless, confused, or afraid, or other mental changes, dehydration, and extreme weakness, having trouble staying awake, or a total loss of consciousness, high fever, and also lightheadedness or feeling faint. So this is the most important part, the treatment for Addison's disease. So treatment for Addison's disease involves replacing the missing cortisol, sometimes in the form of hydrocortisone tablets or prednisolone tablets in a dosing regimen that mimics the physiological concentration of cortisol. Alternatively, 1/4 as much prednisolone may be used for equal glucocorticoid effect as hydrocortisone. Treatment is usually lifelong. In addition, many people require fluorocortisone as replacement for the missing aldosterone. People with Addison's are often advised to carry information on them. For example, in the form of a medic alert bracelet or information card. for the attention of emergency medical services personnel who might need to attend their needs. It is also recommended that a needle, syringe, or an injectable form of cortisol be carried for emergencies. People with Addison's disease are advised to increase their medication during periods of illness or when undergoing surgery or dental treatment. Immediate medical attention is needed when severe infections, vomiting, or diarrhea occurs, as these conditions can precipitate an Addisonian crisis. A person who is vomiting may require injections of hydrocortisone instead. Okay, here are some cases of Addison's disease. A 32-year-old Indian male presented to be outpatient department with complaints of 2 to 3 episodes of vomiting and pain in abdomen. Following excessive binge drinking the night before hospitalization. No history of fever, diarrhea, disorientation, breathlessness, loss of consciousness. The patient also complained of generalized weakness, giddiness, apathy, and lethargy since 5 to 6 days. A history of similar complaints on and off for the past few years, wherein the local doctor treated him on the lines of psychiatric disorder, mainly depressive disorder. Moreover, there is a history of weight loss, which is about 9 kilograms in the last 18 months. On inquiry, history of hyperpigmentation on skin, mainly elbows, knees, lips, and orals mucosa over the last 2 years. Furthermore, decreased libido, disturbed sleep habits, mood changes, but normal bowel habits. No history of visual disturbance and headaches. Serum calcium, serum parathyroid hormone levels, and blood sugar were within normal limits. Autoantibodies against adrenal glands and serum levels for light chain fatty acids could not be performed. However, in this case, the absence of other common etiologies and suggestive MRI finding autoimmune adrenalitis might have been the most likely cause of primary adrenal insufficiency. The patient was diagnosed as Addison's disease. The patient was appropriately managed on intravenous saline infusion and dextrose infusion. The patient was initially put on injectable hydrocortisone 100 milligram thrice a day until he was stabilized. The patient showed improvement. Blood pressure and electrolytes were within normal range by the 5th day. The patient was discharged on oral hydrocortisone 20 milligram in the morning and 10 milligram in the evening, and fluorocortisone replacement therapy 100 microgram once daily as per recommended dose. This is the example of the patient. Just now, the 32 years old Indian. As on the picture on the which is labeled as A, there you can see hyperpigmented patient. The picture which is labeled as B, hyperpigmentation skin, anorexic and thin buildup of oral mucosa and palate, as you can see on the lips and all that. Okay, this is another case of Addison's disease. A 57 years old Caucasian woman was referred to hospital by her general practitioner with a 2-day history of flu-like symptoms, tachycardia and hypotension. The symptoms included malaise, headache, vomiting, appetite loss, dizziness, as well as neck and joint pain. She had a history of hypothyroidism and was on adequate levothyroxine replacement. In addition to her acute symptoms, the patient reported 20 kg of weight loss, lethargy, skin darkening, and intermittent abdominal pain over 12 months preceding the acute presentation. The patient was diagnosed with Addison's disease in crisis, which was most likely precipitated by influenza type B infection. There was no other obvious source of infection. Acute treatment included intravenous hydrocortisone with aggressive fluid resuscitation in the form of normal saline. She was subsequently switched to oral hydrocortisone. Mineralocorticoid replacement with fluorocortisone was also started. She was discharged home with sick. They advised to double up her hydrocortisone dose when unwell. She was also advised to obtain a medical alert emblem depicting that she has APS type 2, APS2, and was on steroid replacement. She was issued with a prescription for an ampule of 100 milligram hydrocortisone to be administered via the intramuscular route in case of Addisonian crisis prior to getting to hospital. The partner was educated on how to reconstitute and administer the parenteral hydrocortisone so that the patient will be feeling better with her. Okay, this is the example of the patient. Pigmented skin of the patient right on the right hand side as compared to the daughter's skin on the left hand side. Okay, these are the reference. Okay, that's all for me. Thank you so much. If you have any questions from my presentation, don't hesitate to ask me in the comment sections below. Please do like and share my videos so that it will be useful for a lot of people. Thank you so much, and don't forget to subscribe to my channel. Thank you so much. Have a good day.